Good morning, good afternoon, everybody. It is 12:58 Central Time, so we got 2 minutes before we start. So we're gonna let everybody join, probably start maybe 2 or 3 minutes after the hour. But thank you all for taking some time out of your Tuesday to spend some time with us. And instead of sitting in complete silence, we'll have some casual chit chat. I've tried fantasy football as a topic to kill time, but usually I don't get much of a response. But same in this crowd.
College football?
Sure.
College football.
I do college football.
All right, you go first, so I know what I'm dealing with.
I'm a Wisconsin alum, so this has been nothing but a miserable experience for us this year of like just nothing consistent about the team. But at least we're having college football and the stadiums are full, so that's fun.
Yeah, I'm sorry about your year. We are a big Michigan household. My husband went to Michigan, so we're having a great year. We're having an awesome year.
Yeah, have fun losing to Ohio State as you do every year, and then having your playoff dreams crushed.
You know, it's okay because we have season tickets there, so it's a fun experience.
At
least it's home.
Every year I keep going like, this is the year I'll go to the big house. Like this is the year, like, oh, Wisconsin is playing this show. Like every year it's like, oh yeah, I definitely forgot to plan or even try.
You gotta buy them early.
So you said you have season tickets?
Yeah, but we're in Pennsylvania, so we don't ever go. We have 2 toddlers and we don't make it up to Ann Arbor that often. But you know, my husband's holding out that one day we'll go. Like one day we'll take the kids. So I let him think that.
My families are all New Yorkers. We haven't lived in New York in 20 something years, and we still have Jets season tickets, which is like, yeah, that's the general response, is like laughter and pity. Cool. That's the thing about being a Jets fan, is like no one tries to like talk bad to you. It's like, oh, that's sad.
Oh, Jets, yeah.
Oh, poor kid.
Russell, how about you? Are you into collegiate football at all?
I am not at all, and we have a like an internal Blueprint fantasy football league, and I'm part of it, but I haven't logged in or done anything in that regard. So I am not. I don't know Matt, what's the status on that league?
I'm the commissioner and I'm losing a lot, and I haven't started cheating yet, but you know, it's a playoff push time, so maybe weird things will start happening and no one's paying attention. So like I'm still losing and trying, which is the worst part of fantasy. It's like Russell's like 6-0 and I'm I don't like fantasy. All right, it is 1:01. We'll give it another minute. Give it another minute. Hello, everybody. Thank you again for taking time out of your busy days to spend some with us. I keep looking at yes.
As everyone waits, so part of the talk that we're going to be having over the next hour, we're going to be asking you some questions that you can write in through the chat or the questions button. I don't know on the attendee side what you all see, but just wanted to let you all know to figure out how you can write in responses to some of the questions throughout the presentation.
Russell stealing my thunder out of the gate. I had a whole speech ready about that. That's okay. So we are going to try to make this interactive. I'm sure we've all had more than our fair share of webinars and remote experiences over the last year and a half. So yes, we'll hopefully get some attendee interaction and really want to get your feedback. I think we will also have something to share with you after the slides are over. But it is 1:02. So with that, welcome everybody officially to the State of Teletherapy in 2021. Excited to have you all with us. My name is Matt Davidman, Director of Partnerships here at Blueprint, that is sponsoring, I believe we're sponsoring the webinar. It's usually what I say to start these things. I will let our 2 awesome panelists introduce themselves. So first off, we have Dr. Russell DuBois.
Hey everybody, my name is Russell. I'm a clinical psychologist. I have a clinical and research background on the research side of things, spent a lot of time in the domain of clinical data science, which is basically the field of understanding how we can use data to inform the process of therapy. So done a lot of work in that regard, and in the past 2 years or so have been the head of clinical operations here at Blueprint, and just offering my clinical domain expertise into everything that we do. And then Kathryn, I'll pass it over to you.
Thanks. Hi, everybody. I am Kathryn Esquer. I am also a clinical psychologist, not too much of a research background, just did it to get through school. And I have been working clinically since graduation, and in the middle of the pandemic, I was feeling kind of professionally isolated. So I founded the Teletherapist Network, which we are an online consultation group for the next generation of therapists. So I'm excited to be with y'all today.
Awesome. Well, thank you. And I will say also thank you, Claire, who is hiding in the background and muted, for always being the kind of the brains and work behind the webinars we do, the slides, and making sure that the three of us know what we're talking about. So thank you, Claire, who is a little camera shy, so I don't think we'll see her today or hear from her. No. Right to the agenda. All right, so we'll spend a little bit of time setting the stage, going into developing a hybrid model, teletherapy and digital assessment, some Q&A at the end. But really, we're going to put a little bit of a focus on kind of how we got to where we are today. A little bit of, thank you, Claire, how we got here, and hopefully a little bit more about where we are going as well. So to get started, a little bit of fun information. As of June 2020, about 75% of clinicians were seeing clients remotely. I think we all know how we got here and the need for it. But about 16% seeing in person and some via telehealth, 3% seeing clients fully in person. So there's a pretty big spread of kind of where we were of, I think, 90+% in person to a pretty rapid shift to a telehealth approach to behavioral health.
I also think just a quick comment on that as well. Clinicians, I think here is defined pretty broadly across different care settings, but I think for most of us on this webinar likely come from private practice or group practice settings, and in those settings in particular, most of us, much more than 75%, we're seeing telehealth clients, and so very much has been a common experience across all these different care settings.
Thank you. So think back. What was your first reaction when learning you'd be transitioning to teletherapy? Oh crap! Totally fine to share into the chat, but we'll start with Russell and Kathryn. If you want to kind of start giving your reactions, and then we will see what comes through the chat. What? Oh, no, that was you.
That's me. Well, that was my first reaction. What now? I was grateful to have already been studying and working on board certification for telehealth prior to the pandemic, but it was kind of like, the floor was ripped out from under me. I was like, I have to jump in now. I have to, literally overnight. I think I felt most for my clients, thinking about, okay, I can handle this, but how am I going to help them handle this, making this transition? So my first reaction was now, really? Russell, how about you?
Yeah, my story was interesting because I transitioned out of doing clinical work right before the pandemic started. And so by the time COVID hit and everything got locked down, I was not doing clinical work anymore. But I vividly remember, so I was part of a number of different local and state psychology organizations. And I remember everyone's communication, like when everyone was trying to figure this out and was like, oh crap, what do I do? My email was just being blasted by all their listservs who were like, where clinicians were writing in with questions and like, I have no idea what's going on. I don't know how to provide, teletherapy. I don't know what to do or what the regulations are. There's so many open questions. And so my reaction and my experience was really like observing this whole thing sort of shake out over time, and a lot of the communication barriers that came up early on. And I'm sure we'll talk about it later on, but I think that's a really powerful reason why resources like the Teletherapist Network is so important, because it's a central place to get advice and tips and just knowledge and information about all things teletherapy. But there's certainly, from my perspective, a lot of panic and uncertainty and open questions.
It was information overload at some point. Absolutely. Or redundant information overload.
Yes, and we are a little quiet in the chat today. So while not a clinician, I certainly spend most of my day in the behavioral health space. So I will also add that, the reason we got here is pretty terrible, global pandemic. But I think at the same time, maybe thinking back to like a month into it, kind of exciting that we kind of broke down barriers to access to care. And I think this is the push that our space needed a little bit to kind of open up the ability to treat differently, to treat, in a more tech forward way, which I know caused a lot of disruption, a lot of anxiety, a lot of, oh shoot moments, I'll say nicely, and a lot of fire drills with even some of our partners who we were kind of working on the rollout of Blueprint. It was like, oh man, like we have to reassess everything we're doing because it's just not going to work the way it currently is. And then we all had our fun Zoom stories, our Google Hangout stories of awkward interactions or just weird things happening. So it was a fun process. With that, we do have a question, and I think this is a good one to ask now as we're thinking about how we got here, as we've all learned a lot. What are the regulations that you know of regarding telehealth across state lines?
Russell, do you mind if I take this one?
Go for it.
All right. So this is a great question, and we get asked this all the time on the Teletherapist Network. And I unfortunately don't have a clear cut or one answer for you. It depends on a couple different things. And this is why peer consultation is so important with trusted professionals that whether from graduate school or your state organizations, people that that you can trust to rely on them for their knowledge as well. We don't have to do this alone, but what you need to look at is where you're licensed. First, your type of license, where you're licensed. So for instance, I'm licensed in Pennsylvania, and I'm a clinical psychologist. They have laws for clinical psychologists about where I have to be when I practice therapy. So it depends. State Pennsylvania says I have to be in this license in the state of Pennsylvania to be able to provide services to clients in the state of Pennsylvania, right? They do not require me to be in the state of Pennsylvania physically when giving services. So first you have to look at where you are located, where you're licensed. Then you also have to look at, say I wanted to provide services to someone in Ohio. I would have to look at the state of Ohio's regulations for clinical psychologists and look at what they require of me to be able to provide services for patients physically located in Pennsylvania. So you have to check two locations with your license, where you're located and where your client is located. If you fit the bill for those two things, not just one of them, you have to fit the bill for both, then you can practice across state lines. But when in doubt, check with peers licensed in those states, reach out to the licensing boards in those two states, but make sure you check both. That is one of the biggest missteps therapists do, I think, is they only check where their client is located. They don't check about the regulations and where they're located. Some states don't allow you to practice with your license across state lines. So make sure you check your states. Russell, anything to add?
No, I think you said that perfectly. The only thing I would echo is that you don't have to do this alone. Peer consultation is so important. So just want to emphasize that point.
I have nothing to add to that. That was a great answer. So thank you. Great question, anonymous attendee. So I can't thank you personally or directly. But we did have one comment in from Deborah. Thank you. Clients being able to manage technology difficulties and still being able to have productive sessions. We are a tech company. I have my own tech issues here and there, never with our platform, usually with other things, of course. But yeah, I think that's definitely one of them. Is just because you have access to technology, both sides have to be able to use it correctly and get through some growing pains. I think we all mostly got through together. I will ask this one. Are you familiar with SciPact? Yeah, I don't want to make some weird name there. If so, pros and cons.
Yeah, I'm actually a member of SciPact. I'm a huge proponent of it. There are a lot of, so for those of you not familiar with SciPact, it is a multi-state legislation movement in which states can go ahead and enact SciPact or pass SciPact laws, regulations, forgive me, I am not in Congress. But that means that anyone who is registered with SciPact, and it's for clinical psychologists right now only, if you registered with SciPact, which is actually a quite intensive process, it took me a couple months to get through, then you can practice in any one of the states that enacted SciPact legislation. A lot of pros, a lot of cons, too much to get into right now, but the overall pro is you have a lot more flexible licensure mobility. Con is you still have to look into each individual state's legislation, because for instance, New Jersey just enacted their SIPAC legislation is going to be active. They approved it. It's going to be active at the end of next month. But in order to practice, you can't just be a member of SIPAC and then practice in New Jersey now. You actually, part of their legislation is you have to pay, I think, $1,500 to become registered with their state, even though you're already SIPAC registered, to then practice in New Jersey. So each state has its own individual SIPAC legislation that you have to look into as well. So lots of pros. We're moving in the right direction, but still more to look into.
Awesome, thank you. And I just couldn't not read that as Psype Cat. And I had to pause and just not say anything. All right, we got one more question before we move on to the next slides. Thoughts on CMS requiring in-person visit prior to having a telehealth session? Kathryn, to you to start.
Sure. You know, I could go either way on this. I think that they probably have their reasoning behind it. I think it does preclude a lot of people who perhaps don't have access to reliable transportation or childcare or time off of work to be able to make it to in-person sessions. We all know there's a ton of convenience and accessibility and decreased barriers to entry with telehealth. So I guess I'm not necessarily in favor of that, but I don't know any research behind it, so I don't want to speak too black or white. Russell, do you know anything else?
Yeah, no, I don't have any more opinions other than what you just said. So yeah.
Awesome. Thank you, Karen and Ivy, for the last couple questions. So moving to the next slide. COVID-19 obviously forced us to evaluate things in a speed of which I think we were all unexpected or unprepared for. Will teletherapy be as effective as in-person? I think that kind of goes back to the question we were just talking about. Is my platform HIPAA compliant? That was a very fun one for the first months. FaceTime, Google Hangouts, Zoom, all of the options. Our insurance companies reimburse.
Matt, quick, I'm going to interrupt you quickly to say I'm going to launch, there's a Zoom poll that we can take. And so I'm going to launch that for all of you who are listening in. Feel free to take that poll as we talk about this.
I just learned about this apparently. Yes, and this way I don't have to read off all the questions. I think you can all read what's hopefully on your screens, but I will continue anyway. Insurance companies reimbursing for telehealth the same way as in person. Really a big emphasis on can I maintain continuity of care. I like this one. Am I even qualified to provide telehealth? That was an interesting one for the first few months. And what are the rules for telehealth? Obviously, these are all very good questions and very thought-provoking, which is why Claire did an awesome job preparing them for us. So I will give it about 30 seconds without us giving our answers to skew the responses, but oh, I can't vote. I'm a host. Sad. Not that I have a true opinion here, but I think it's a good question. I'm excited to see your answers. And with that little bit of stalling, Kathryn, what are you going to go with as the number one?
And I think this goes back to maybe my own set belief systems, but I went to, am I even qualified to provide telehealth? Even though I was in the process of getting board certified, I still doubted, but I don't have the training. I don't have the consultation, but I didn't learn this in graduate school. My biggest fear was, am I even doing it right? Am I even qualified to do this?
Awesome. Russell.
Yeah, I would say I think it's definitely a combination of that. I think from my perspective, seeing all of the changes in the reimbursement side of things was a little bit scary for me in terms of thinking about the field. I know that payers can take a long time to enact changes, and I think there's a lot of uncertainty around payment and reimbursement and all that side of things. And so from an uncertainty perspective, that's where my mind went. And it looks to, so we have 65% of attendees participated in the survey, and it looks like reimbursement was the number one. 47% of you all who submitted the poll said that the reimbursement uncertainty was the largest stressor, which certainly makes sense. I'm actually kind of surprised by this. Second to that, 41% of you thought that the number one stressor was, will teletherapy be as effective as in-person treatment? So effectiveness of care, I think, is interesting, and we can talk about this later on as well. But there's been a lot of research done in that space, and specifically looking at, has our effectiveness changed as we transition to telehealth? And overwhelmingly, like at the population level, if you look just across everybody, it looks like telehealth is just as effective as in-person therapy. There's obviously some outliers there. There's certain populations that do better in person. There's certain types of treatment settings or treatment modalities that will be better in person, but at the population level, it's looking like from a effectiveness standpoint that we're just as effective online as we are in person. Kathryn, curious your thoughts on that side of things.
Yeah, I loved when that research came out. I think that you're absolutely right. There are obviously going to be some counterindications and some, you have to take an individual consideration when selecting or choosing whether to provide the option for telehealth for your clients. But when appropriately selected, screened, and when therapy is conducted, to the standards, the highest standards of teletherapy, what we know now, then it is as effective. And I think everyone, at least in my circle, let out a sigh of relief when that research came out, because a lot of us are hoping to continue to provide telehealth services as we move forward.
I will sorry, after you, Russell.
One of the things that really fascinated me about looking at effectiveness and outcomes is most, if not all, of our evidence-based practices were conducted with in-person therapy in mind. And so from my research brain, my first thought was, will these evidence-based practices continue to be effective when done in this different context? Because context really matters, and context can play a large role in whether or not a therapy is effective or not. And so early on, we can talk about this a bit later on as well, but there's this notion of practice-based evidence. So not just relying on providing an evidence-based practice like CBT or ACT or whatever it might be, but using data to help you understand if that evidence-based practice is actually working for the clients who you're working with. And so this transition to telehealth was a great opportunity to enact that mindset of, it's not enough just to say, hey, I practice CBT or whatever it might be, but also being able to collect practice-based evidence, like actual measurable outcomes, to make sure that therapy is as effective as it's always been.
I will ask a quick question to the crowd. How many of you, if any, are using objective measures as part of that kind of effectiveness observation, or being able to track some level of effectiveness through data outside of more of the subject? Well, Kathryn, yes. I knew you would say yes to that. But you don't have to answer now. Think about it. I will guarantee you that comes up later in our presentation as well. But if anybody does have anything good to share about their use of measures or data in identifying effectiveness, would love to hear that as we continue through.
Can I jump in?
Yes,
one of my favorite parts of using evidence-based care is, and this was kind of unexpected, I really love being able to systematically get feedback from my clients on our rapport, on our therapeutic alliance, what's working, what's not. And the fact that they come to expect that as part of their treatment with me allows them, I think, it creates a much different, or I should say, it feels like a more open space for them to provide even anecdotal feedback in the middle of a session. The fact that I regularly welcome that and encourage it, make it part of the process, has had tremendous benefit in my work. So maybe not just the symptom outcomes, but the therapeutic alliance has been great to be able to look at.
Awesome, thank you. Claire? There we go. But getting it right mattered then, it still matters now. I think more than anything, this experience of remote care telehealth, especially in the behavioral health, mental health world, is now an expectation. Maybe not every session needs to be, but your clients are expecting that there should be some level of option to be remote, or at least have some part of the therapeutic process be remote, whether it's the data collection, whether it is session or worksheets or sharing some type of information back with their clinicians in a digital way. Having some type of this process built into your practice will also help you kind of maintain some level of independence. There are large groups out there that are moving to buy up as much as they can in that behavioral health space. But there is still this, I'm all for these independent groups, these private practice groups that really can focus their care on their clients and their community, as opposed to just being, one of thousands that can go national. So really, we want to put that emphasis that there is this expectation for digital. And now how can we make sure you can get something offered to your clients that keeps you unique and keeps you at the top of their mind when it comes to getting help? And I think a lot of that is this hybrid model. So how do we develop a hybrid model that works for our practice, our clients, our clinicians, and more importantly, our community and those around them? I think what's cool and exciting from my perspective is, when you treat a client, when you help a client, you're generally not just helping that one person. It's their ability to interact with others, their family, friends, community. So it really goes beyond just that individual. So I will go back to the slides now. Teletherapy, developing the hybrid model that works for your team. I think that is really what we are talking about when we are looking at the state of telehealth and the future of telehealth. So I will really hand this over to Kathryn and Russell at this point, but some things to consider as you're thinking about moving to hybrid, moving to a digital in-person experience. And yeah, we'll talk about clients, clinicians, staff. So Kathryn, I'll hand it over to you.
Yeah, I would love to see maybe some thoughts of the attendees. If you guys could drop some of your thoughts in the chat about questions you looked at or factors you considered when the regulations were lifted or are still lifting, and you're considering or already have maybe adopted more of a hybrid model, or if you chose to say all remote work, teletherapy. I'd love to hear some thoughts in the chat, and I can share my experience with what I ended up doing with my practice. I work in a very rural town in Pennsylvania. I grew up here and I love it. And I actually moved back. I lived in cities for about 10 years with my husband, and we moved back so I can serve the community. And so it's a very unique community at that. In the sense that we have a large healthcare system, 2 universities, and then a lot of farmland. So it's a very diverse population I work with in terms of resources or access to technology. So we had to switch overnight to teletherapy. I ended up doing a lot of phone sessions at first because a lot of my clients didn't immediately have access to reliable Wi-Fi, which sounds ridiculous to some of you, but it's a fact of living in a very rural area. And so we did a lot of telephone therapy. I did video when we could. And it didn't go as bad as I thought it would. Telephone therapy, just audio only, wasn't as horrible as I thought it would. We were able to continue not only stabilizing, but continuing to make some progress without having those visual cues. And so that was one of the big highlights for me, that the outcomes still continued to be positive, even in the most basic teletherapy sense, just audio only. So when the regulations started to lift and I needed to think about how can I use what I learned during this period of lockdown, and I did telehealth exclusively for about 4 months. And when I had the option and felt comfortable going back into my office, which is in a primary care facility, I had to consider a lot of different things. I had to consider, what worked for me in my life. I had 2 toddlers at home and still no childcare. So that limited what I was able to do right away to go back to serve my clients in person, because it didn't work for my life. I couldn't make that work for my family. So I think it's important for us to consider what works with our lifestyle, what works with our family, what works for us, because when we take care of ourselves and when we create the practice that fits around our strengths, not just us as clinicians, but us as whole people, as mothers, as spouses, as partners, as all of the roles. When we create a practice around that, then that ultimately helps us serve our clients better, and our clients are served better. So so I had to delay going back to in-person because it didn't work for my lifestyle. And I was looking at the reimbursement rates, and thankfully in my area, I am 100% insurance-based. And my reimbursement rates were actually better than what they were for in-person in some services. So I was able to look at that and say, okay, I can go back to in-person. I don't feel forced out of this. I don't feel forced out of telehealth because they're not reimbursing as well. And I went back to the office. I started off just going back to the office personally, I needed that social connection. I work with a team of physicians and nurses, and I miss them tremendously. They were working frontline the whole pandemic, and I wanted to be back with them, back with my team. So I went back and did telehealth just in my office with my coworkers around. And that was a really great transition for me, because it allowed me to make sure my office was set up for telehealth, because I knew that this was going to be something I was going to offer moving forward, at least in some aspects. It allowed me to get back in the office, feel comfortable with exposure to COVID and whatnot. This was mid 2020, so this was a whole new vein of practice. And then eventually clients started asking to come back. And so this was where I started to take individual considerations into mind when developing treatment plans on if we wanted to go back to in-person or continue remote work. Currently, I have transitioned to most of my clients prefer to be in person. Although for me personally, all of my clients have the option, because my health insurers are still reimbursing for telehealth. They all have the option to switch to telehealth if they are sick, or if they are unable to make it to the office, if they don't have reliable transportation. And a lot of people in my community, unfortunately, don't have reliable transportation. So having that option of, I think I can get a ride, but I'm not sure if I can get a ride. Well, I better cancel if I don't know if I can get a ride. Having that option for telehealth allows them to actually more consistently attend therapy than if we were in person and that's it. So I personally have a hybrid model, not only to serve my life, because with kids in daycare, we get quarantined a lot. So I've had to resort back to telehealth for weeks at a time as we quarantine, or for my patients to be able to continue care. I think that I look back to my practice prior to the pandemic, and I recognize a really big missed opportunity of not having telehealth as part of my practice back then, not having telehealth for the people who cannot make it to my office or cannot find childcare, or for the new mothers who can't get out of the house, or it's very difficult and they wouldn't attend therapy otherwise. So all of these factors, there's no right or wrong answer, but you have to consider all of these factors: your practice, your finances, your life, your lifestyle, your family, and what works for you and the populations you serve. I think that, this was a very long-winded answer about what I considered when I transitioned to a hybrid model, but it kind of naturally evolved, and I allowed it to do so by thinking about things as they developed. I think it was a very natural process for me. Not natural at first. It was very forced at first, but it became natural. And I hope that you all can have a natural process as well of, developing the practice of your dreams that fits into your life and serves your clients the best. So yeah, that was my journey of hybrid model, and I'm excited to keep it going and see where it goes from here. We might go, I don't know, might go all telehealth one day, might go back out into all person, just be open. Russell, what are your thoughts on hybrid model?
Yeah, no, I think you said it perfectly. I think there's, we can hopefully transition to a future where you can take the best of both worlds. I love the notion of giving clients the opportunity to choose their own path, so to speak. Access to care has been something that telehealth has really helped with, where many more individuals are able to to have care and to show up for care despite all the other challenges that might be going on in their life. And so keeping it as an option, I think is really powerful. And so I completely understand and agree with that. Also, quick shout out. We have I think the sort of work-life balance, personal boundaries side of things is, for me, at least, the other one that really comes to mind. It's really a personal choice, and like what works best for you, and what your needs are in a work environment. But shout out for our webinar next month. We have Bridget Richard, who is joining us. She's both a group practice owner as well as an expert in clinician burnout. And she does a lot of coaching to clinicians around burnout and just how to maintain a healthy lifestyle, especially when you're doing work from home. And so if there's anyone who's interested in that side of things and getting some tips and tricks and all kinds of stuff around all things burnout and self-care, I would highly recommend joining that event next month.
I will add one other question here for those who are owners, directors, supervisors. How is our clinical team working? Am I doing supervision? Are we talking about the cases and therapy and everything that really goes into that, as I stumble for my words? But are we still effective as a team? Are my younger clinicians or the newer clinicians still being supported and given the help that they need in a remote environment, in a hybrid environment? Are they coming into the office at all, to the practice at all? I think it's definitely another question to consider is, how are we the team, and not just me, the clinician, them, the client, but how are we still working together and really ensuring we are delivering on what we are saying we are to our clients as a group. Oh, Claire, sorry. I was going to read Claire what Claire says. We will include the webinar registration link for our November webinar. Thank you, Russell, for the delightful plug as well. So I think we just addressed a lot of what needs to be addressed or thought about as you move to hybrid. But for those of us that are, I'm sure most of us are already there, we're going to have a fun little exercise about keep or toss. So if you could keep any part of this remote hybrid world we're in, what would you keep? And if you're going to toss it, what will you toss? And a quick note on audience participation. Participate, it's fun, but also we are going to kind of put all of the responses together and hopefully make some type of ebook / guide that we can send out hopefully pretty soon after this. So I will kick it back to our awesome panelists. If there are things you could keep or toss, and I will say it nice and slowly to give everybody a chance to type in some things before we start answering, what would you keep or toss? Kathryn.
Oh, me first. I'm going to try and think about my biggest keep would be, I would say flexibility, but it's up there and that's kind of vague. So, and I love flexibility. I think that this pandemic has forced me to be flexible in so many different ways. So definitely that one. But I think other than flexibility, I am going to keep, I have a stricter no-show and late cancellation policy because telehealth is now an option. So I'm going to keep my stricter and very concise cancellation and no-show policy, which is you get charged if you cancel or no-show me or cancel with less than 24 hours notice, because for any reason I do, including sickness, because telehealth is always an option now. So I'm going to keep that. Russell, what are you keeping?
Ooh, yeah. So I'm going to keep, this is coming not from the practice side of things, but just the field at large. I think despite a lot of challenges with learning new things and change happening quickly, which is difficult, like change is hard. I think as a field, we've embraced change and we've been willing and able to change very rapidly. Specifically when it comes to really important topics around access to care, around payment structures. And there's been some really major changes in our field that have happened at a really quick time frame. Typically, for whatever reason, our field moves at a really slow pace. And so it's been refreshing to embrace this spirit of change. And so that's what I would want to keep going forward.
We have 2 responses from our awesome audience. Keep convenience for clients and keep accessibility, reach more clients. So quick theme I think we're definitely seeing here is hybrid makes clients more likely to get to where they need to be, whether it is in front of a computer, phone, other tablet, whatever technology it is, or in person. I think I would absolutely agree that removing the barriers of access to care is probably the best aspect of what has been a rough couple of years. Because, and I think as Kathryn was just saying, like, what's your excuse for not getting here? Like, you need a phone to go like this and hold for an hour, 30 minutes, however long your session is. So I think that's absolutely it, is especially in the rural communities, people without access to care. I have an amazing 16, 17-month-old kid, and we have one car. So if my wife is at work and she commutes to work with our vehicle, I'm at home with my kid, who I adore, but I can't get out. And if he's sleeping, I still can't leave the house anyway, because apparently an adult needs to be home when they're sleeping. So the little things like that, thank you, Russell. Just having the ability to more freely communicate with your clinicians, your help is incredible. Keeping a 100% telehealth practice from home and tossing the pressure of needing to do in person. I love that. I am certainly not a clinician, but I love being home roughly 5 days a week. I do go into the office occasionally. Why commute? I think that's even better. Is I have a roughly hour commute each way. That's 2 hours of my day gone. That's 2 hours I could be doing more work, spending time with my kid. I think Kathryn mentioned as well, like, you're home. Why not enjoy that moment? Well, you can still put your full commitment to work. And I don't miss driving in traffic for an hour each way. In Chicago, I don't know if you all know about our traffic, but it's not the best. So I think that even like that small quality of life of just, I don't have to think about it, I don't have to get frustrated, is amazing in my day-to-day of just being able to kind of focus on other things. So it looks like we have a lot of things we want to keep. What are we getting rid of? And
I'm going to get rid of being forced to do anything. We were all forced to do telehealth. We didn't have an option. I don't do well being told what to do. So I'm getting rid of being forced to do anything. I think it goes back to the flexibility, being open, having options, not feeling like it's black or white. We as clinicians know nothing in this world is black and white. So yeah.
Russell.
Yeah, I'm going to toss technology issues. I know, especially in the process of therapy, technology shouldn't be getting in the way of that. And we're talking about and working on really heavy and difficult conversations with our clients. And so to have technology issues interfere with that process can be really, really frustrating. And it's interesting because I'm coming from a previous place of doing therapy and now working for a technology company. And so I know the pain of being in a session and just having things not go your way. And I think we're making a lot of progress across the board on reducing the amount of issues, whether it be connection issues or just technology not working. And if there's anything I could just toss and like have never come back, it would be all things the technology issues.
I will raise this question, especially because it's an example as lack of boundaries. Toss insurance limiting or not covering mental health or telehealth. Yes. I don't think anyone's going to disagree with that.
Absolutely.
There's nothing more frustrating than someone coming for help and wanting to help them, and then financials being being able to not get around their financial situation, be able to help. I know that's probably one of the most frustrating things we can experience, especially if they have insurance, and then they're just like, no, this person doesn't get it. Love dealing with insurance. I know part of what we do is work with some of the payers about what we'll talk about in a little bit with assessments and the value of measurement-based care. And there's nothing more frustrating than some of the payers requiring that you do this or starting to require that you do this, but also not compensate for it. So it's definitely something we are aware of, and we want to really kind of remove those obstacles and barriers. So great comment, Jennifer. Thank you. Boundaries. I will kind of go through my wife's experience as a primary care PA with some new laws in Illinois about having to. I think it's Illinois, not her former practice, but when lab results are getting in, they're being forced to be sent out within 24 hours to the client or to the patient in her world. That's creating some boundary issues. People don't know how to interpret their own results. So they're seeing these things and immediately reaching out to her, to the clinical team she works with questions at all hours of day and night. I'm curious from the behavioral health, the clinical perspective, is more remote communication, whether it's through the EHRs or my portals or my charts, whatever they may be, are you starting to blur the lines of when you are client focused, when you are supposed to be responding to your clients, when it's inappropriate to you? Are you still doing it? Are we working 8, 9, 10? Oh, it's one email came in, I can respond to this. Or are you really setting the boundaries that, look, after X PM till Y AM, you're not going to hear from me? How has your approach been to that?
Yeah, well, listen, we're in the field of mental health. Well, any field you're in, you're going to have people who push boundaries, whether you're remote, whether you're in person, you're going to have people that push boundaries, especially in our field. And it's really up to us. I did a very poor job of boundary setting with work-life balance. I'm pretty good with clients, setting those boundaries. Very poor job at the beginning of the pandemic between work-life balance. I was working way too much because I could just walk to my office and work. And so it's really up to us to set those boundaries. We have been trained in graduate school. We have had supervision. We should be continuing to get peer consultation on these ethical considerations when it comes to client provider boundaries. We really need to have a very solid and very confident, policy in terms of communication, in terms of social media, in terms of interactions and accessibility. And if you don't, I encourage you to get with a group of peers and see what they're doing, see what works for your practice and see what doesn't. Tailor it to what works for your practice. So it's really up to us to set those boundaries with our clients. And I think we know that as clinicians, but the same principle applies for our work-life balance. And I'm excited for the next Blueprint webinar about therapist burnout, because I think boundaries have a lot to do with that. And I know I experienced that in 2020, but no one's going to do it for us. It's completely up to us. And sometimes those internal boundaries are a lot harder to set than external.
Looks like we also have another question that came in. Kathryn, probably best for you. Will insurance companies such as Medicare continue to accept telehealth as a treatment modality once the public health emergency lifts?
Gail, that is an excellent question, and that is the question on everyone's mind right now. There are some legislation initiatives that are trying to be implemented so that it does stick around. But as of right now, we do not know. Unless, Russell, you have any other information that I am not aware of.
I do not, unfortunately. I wish I did, but no, I don't.
So stay tuned, absolutely stay up to date, follow your professional organizations, stay in touch with your state organizing bodies or your professional organizations at your state level. Stay involved with those organizations. They're going to be the ones that you can get the most accurate and up-to-date information on. They're the ones out there lobbying and trying to get the legislation passed.
Awesome. Well, thank you for the question. Thank you for the responses to Keep or Toss. It might be a short ebook, but we will make something of these responses. So thank you for that. Moving on, and if at any point, if I just thought of a Keep or Toss, let us know. We can always jump back to that. So I think we're going to move again into the what comes next. We know how we got here. We know some of the obstacles we've overcome. So where do we hope and think this digital remote hybrid world is going? And one of those areas is the role of digital assessment in teletherapy. So I will actually hand this over again to Russell and Kathryn to dive more deeply into this, but very excited to kind of share their thoughts and opinions on this with everybody.
Yeah, so I can start here. So I think it's important to turn this discussion and focus a little bit on the unique contributions that digital assessment has had on the process of providing teletherapy. I think there's some unique and interesting stories to be told. So I could spend a little bit of time talking about this. And if we take a step back and think about how we used to just understand our clients, like I use the term assessment here with a little a, like big A assessment being like formal screening, formal, psychological testing, little a assessment being, all the other things that we do as therapists to understand our clients and their lived experiences. And, historically, when we work with clients face-to-face, assessment comes naturally to us. And in some ways, that's what makes us as clinicians so special, is that we're trained to read between the lines and understand our clients and what they're going through in a variety of means. That may have been through screeners and measures for some of us, but most of us really just through the conversations that we have with our clients. especially when you're with a client in a room, there's no distractions, it's just you and the client. Nonverbal communication plays an equal role as verbal in the ability to, observe these nonverbal cues that give you just as much information about our clients as what they're actually saying. And then, of course, there's something more salient or potent about, being face to face when it comes to things like transference, counter transference, the relational aspect of things, and really just a human condition. Like, we're social creatures and we respond in certain ways when we're in close proximity with other people. It's just kind of who we are. And so when we all started to practice teletherapy, there were some unique barriers that sort of arose in that context. This on the screen here is just a very small list of those things, but there's certainly privacy and contextual issues. You may be working with an adolescent who is worried that their parents might be listening in, or I'm sure we've all had that experience of clients calling from their car because they couldn't find somewhere private in their homes. These are very powerful contextual factors that have influenced the way that our clients express things to us and communicate to us. We also, of course, lose many of those nonverbal communication cues that we had back when we were in person. It's not all gone, but we don't have that same level of rich and nuanced information over video chat that we do in person. And then there's barriers related to breaching difficult topics. So as an example, I've worked a lot with the trauma population, especially those individuals who can become easily triggered. And a big part of trauma is helping them verbalize and work through some previous experiences. And so breaching those topics or questions can become even more challenging when these clients aren't in the safety of your own therapy office. So these are, of course, just a small handful of sort of challenges that arose as it relates to understanding our clients. But I'm actually curious to hear from the listeners. When working with a new teletherapy client, like let's say you're meeting someone for the first time or for the first week or two, what are some of the unique barriers that you experience as it relates to teletherapy that may have gotten in the way of having a full and accurate assessment or understanding of your client's experiences? So I'll let you all write that in, but in the meantime, I'm curious, Kathryn, your just perspective on this side of things.
Yeah, so I saw that question pop up and I've been thinking about it for a bit now. And I think the biggest thing that gets in the way is the slower to build rapport over teletherapy or over virtual communications. And so, when we're doing an assessment, we really, I think we undervalue, or at least undernotice the amount of rapport, the amount that rapport plays into our ability to get a full and accurate assessment. There really has to be a level of trust there. And as we know, with teletherapy, rapport is built more slowly and differently. We have to do different things to build rapport that we can't do if we'd be one-on-one. I can't hand someone a tissue box through the computer screen, but I can do different things like be very consistent and extremely reliable. Those things have much greater weight in telehealth than they do. They're still important in person, but we really have to take the small lines of rapport building we have available to us in telehealth and really make sure we hit those home. So I think it's the rapport, and it kind of goes back to why I like the consistent assessments as part of my practice, because it helps build that rapport and check in on it and welcome the feedback.
How valuable, if at all, are you finding therapeutic alliance, if you are measuring it, and correct me if I'm wrong there, is that a beneficial tool to kind of supplement the soft skills, the in-person approach, where at least the client can give direct feedback on, are we working well together? How strong are we client-clinician in that relationship?
Absolutely. I think even more so, welcoming that discussion of therapeutic alliance or rapport is needed in telehealth more so than in person. I mean, it's obviously we need to do it in person, or we should be doing it in person, but I think it's absolutely needed in telehealth because we don't have the nonverbals. It's more difficult to build rapport. We have a physical distance between us. And so welcoming that conversation, making it part of the treatment. Yeah, absolutely. We can, identify ruptures that maybe we didn't know happened, that maybe would have been more identifiable or easily identifiable in working together person to person in the therapy room. So yes, absolutely.
And I think that's actually, we just got a comment. This might be a toss, it might be other, but technology issues that get in the way, like freeze frames, choppy, random, when you're middle internet connectivity issues, trying to have a little bit of fun with it. And I think that goes right back to it is you can't develop rapport if all of a sudden the screen goes black and you can't hear someone and then you have 10 seconds to get it back. I think that's a great comment at the right moment about things we're not going to hopefully miss as we move to this more hybrid interactive world we're heading towards. So thank you for that, Ivy. Again, if you have comments, if you want to add in later, please do not hesitate to add in at any point. But I think this goes to kind of what we've been talking about on and off in the background of this is clinical assessment and teletherapy, and kind of how we can supplement some of what we're losing of in-person or even enhance the in-person experience as well with what Russell and Kathryn are about to speak more to.
Yeah, and I'll be very brief here because I am mindful of time as well. But just want to note that digital assessment can help overcome some of these barriers. We work with therapists all across the country on this, and some things to point out specifically around the relational issue side of things. So I'm a huge fan of measuring therapeutic alliance. It can be a little bit uncomfortable at times too. Like it's almost it's a new experience as a therapist to ask your clients directly about therapeutic alliance. But it's such a fabulous tool to help you gauge your own blind spots, especially from the relational side of things when there's technology issues going on and all things getting in the way of just having a solid relationship with your clients. And then the other just quick thing to note here as well is one of the exciting things about the improvements in innovation around assessment is we're no longer confined to these sort of antiquated symptom rating scales, like measuring depression, anxiety. That stuff is great. Like you can certainly do it, but you can also have a lot more access into your clients' lived experiences through different types of assessments. So clients can journal, clients can track their own moods, clients can write about their own symptoms in the course of their actual day and share this information with you. And so there's some wonderful tools and resources that you can use as a therapist just to be the best therapist you can be and have rich and meaningful conversations with your clients. And then if we go to the next slide.
Hey, Russell, I will share one quick story. I think on the privacy issue, I think Kathryn mentioned it. Many of us are home with our families nearby, kids or parents. I think one of the things I heard that stuck with me the most was just being able to put a digital daily journal in place. A teenage client was having a very difficult time expressing herself on the video call. No, I don't think anyone has soundproof rooms in their home. So, with a parent walking by or a sibling walking by, it's a little uncomfortable to share these types of things. But by just being able to write it down digitally in a digital journal, the therapist is able to see that. And it really changed the focus of the conversation and really the overall treatment of that client. So I think even like the little things, it's not just the measure, it's not a score, it's kind of that soft, more interactive of like, hey, this is what I'm seeing and this is what you're saying. Where is that disconnect? And that's just a story that stuck with me from one of our partners. So I will zip it.
Yep, and then one more story as well as that on client engagement. So one of the interesting things about telehealth has been that there's been a change in the way in which clients engage in treatment services. And just wanted to quickly mention one example of that. We published a pretty awesome case study with Move Forward Counseling. They're a wonderful group. And one of the things that we found was that when clients complete routine and measures throughout the course of care, there's a 25% reduction in no-show appointments. And so they're less likely to cancel or to not show up because they feel connected to the process of care. So pretty cool case study example of some of the other benefits that can come from this assessment experience. But with that, I will hand it over to Kathryn. I think the last thing to note here is throughout all the stuff we've said, there's a common theme around community and not being here alone and not trying to solve all these issues and open questions on your own. And so Kathryn, I'll pass it over to you.
Great, thanks. So for those of you who are interested or feeling a little isolated or interested in connecting with like-minded therapists, I would love for you guys to check us out. We are the teletherapistnetwork.com, and we do a ton of different stuff. We have grown tremendously over the past year. We are all clinician members and all clinician led. We have weekly live consultation groups. We have dozens and dozens of masterclasses. Peer support, we get media requests, we have book clubs, we do a lot of different stuff. So come check us out.
Awesome. Thank you, Kathryn. And yes, Russell, there was a question, where do you find these tools? Are they available for all types of clinicians? Yes, Kathryn just talked about the Teletherapist Network, which I think is an amazing community, especially around the guidance and support. Blueprint is a measurement-based care platform where we help deliver measures, symptom trackers, worksheets remotely through apps, email, text, and multiple other options. I believe interested in Blueprint. There we go. bph.link/October. A month free for this, and I believe 50% off your subscription for the Teletherapist Network as well, for joining us today. So yes, you can definitely find us blueprint-health.com, bph.link/October, and the teletherapistnetwork.com as well for these tools. There are certainly more tools out there. I literally cannot think of something right now. Just as I was getting ready to conclude this, I'm like, oh, what else can I add? And I got nothing, unfortunately. But yes, I think these are definitely good options for all types of clinicians, your master's levels, your psychologists, psychiatrists, even prescribers, the medication management. So we're very excited to kind of keep pushing technology forward in this hybrid world we're experiencing. I think that is really one of the best aspects of direction we are seeing in terms of the 2021-2022 transition of this remote hybrid world. Of there are more tools, there is more technology in what is a general good way in the telehealth space, in the behavioral health space especially, that's really helping give more opportunity and more insight into clients' state of mind and how they are and where they are, to better treat and give the best data set to support your clients in their process. I think that's what really excites me about groups like Teletherapist Network, like the work we are doing, is it's all in an effort to push treatment forward and to push the level of care in the right direction. And it's really an amazing opportunity that we kind of had this reset, and that's what we're able to do because of COVID and where we are right now. So with that, though, thank you all very much for joining us today. Thank you for the participation from our audience. Kathryn, thank you so much. Amazing to have you with your insights into the telehealth world and how to be the best telehealth we can be, therapist we can be. Russell, thank you always from the Blueprint side. And Claire, thank you. I still bet you will not turn your camera on or say anything, but Claire, thank you so much for all the work you do behind the scenes to get these webinars going. And there's Claire.
Hey, Claire.
Hello, Claire. But yes, thank you all very much. If you have any questions, please feel free to reach out. You can reach us directly through the website we've listed. Kathryn, I'm sure you can find through that website as well. So thank you all very much for your time today, and have a fantastic rest of your Tuesday.
Bye, everybody.
Thanks, everyone.
Bye.
See ya.